Let's pick up exactly a little place that we kind of mentioned previously in the last video there where, slippery slope, right? Yeah, no, definitely. Businesses of over 100 employees, okay? Not just specifically in one site. No. Like all your big corporations, all of your big supermarket chains, okay? Your paycheck every 2 weeks or at the end of the month has the same name as 100 other people on it. You're going to be subject to the January 4th drop dead date, which it will be if more people don't get vaccinated. Shut up. But no, it's not going to stay at 100 fucking people. Of course it's not. It was never going to, okay? All of this shit is just insane, and this dude should just absolutely paint that mask yellow because he's a complete quack. Am I right? The Biden administration emergency COVID-19 vaccination requirement released today could be expanded in the future to employers who have fewer than 100 workers. Count me shocked. The emergency temporary standard issued by the Labor Department's Occupational Health and Safety Administration and scheduled to go into effect on Friday is presented as only applying to firms that have more than 100 employees, but OSHA is seeking public comment on the aspect of the standard. Yes, public comment, okay? Only from sympathetic voices, I would imagine, and it may ultimately be expanded to include smaller businesses, the agency said in the 490-page document. All right, so I guess it is out there, but it's 490 pages, and it just got dropped this morning. I don't think anybody, at least who could decipher that legalese, has gone through all of it quite yet. OSHA said it is soliciting stakeholder comments and additional information to determine whether to adjust the scope of the ETS or emergency standard to address smaller employers in the future. You fucking monsters. The agency is seeking perspectives from employers, it indicated. Oh, okay, cool. OSHA seeks information about the ability of employers with fewer than 100 employees to implement COVID-19 vaccination and or testing programs, okay? You have instituted vaccination mandates with or without alternatives or requirement for regular COVID-19 testing or face covering use. What have been the benefits of your approach? I don't think that there would be many. I think that the detractions would be a much larger list. What challenges have you had or could foresee in implementing such programs? Oh, I don't know, like going out of business because nobody wants to fucking keep up with this theater any longer. Is there anything specific to your industry or the size of your business poses particular obstacles in implementing the requirements of the standard? Yes, and it's none of your fucking business. How much time would it take? What types of costs would it incur? And how much would it cost for you to implement such requirements? A lot. And we don't need your help with this one because it's not your job because we apparently live in a free fucking country. The standard takes effect on Friday, but it also serves as a proposal under the Occupational Safety and Health Act. See, I keep switching that up because health and safety just rolls off the tongue a little bit easier. That means it's OSHA, okay, is seeking feedback and may adjust the finalized version based on the comments. Yeah, if they get one sympathetic voice out there, we've received feedback where it's popular for everybody who's employed to need a vaccination, so it's just going to be right there as well. Now we're going to tell you what vaccines you need, when you have to get them, how many you have to get. It'll just be right there, right next to your social insurance number. Don't worry about it, it's fine. The standard forces many private employers to require proof of COVID-19 vaccination for workers or submit COVID-19 testing on a regular basis at least once a week. I'm glad this is all about keeping people safe and it's not about becoming an incredible burden. The standard forces, workers who refuse to provide proof must be compelled to wear masks because only the people who don't want to disclose their medical history, or at least certain aspects of it, they need to be just properly segmented and they need to be properly labeled out in civil society because that's how things work. The deadline to comply is January 4th. And you know who has to comply on that one? 17 million healthcare workers. We've seen a lot of them, a whole host of them, specifically in places like San Francisco, especially in New York, we're going to get to because there's some more just real cringy shit happening out there. But before we get there, throughout the rest of the country, okay, 17 million million healthcare workers in total. Not that long ago, they were heroes. Now, if you don't get the jab, you are unclean and need to be removed from society. Awesome. I'm glad we've got this far. Okay, remember, we were all in this together for 15 days to flatten the curve. Center for Medicaid Services, on Thursday issued a rule saying that most healthcare workers in the United States will have to be considered fully vaccinated. And what does that mean? Don't know. As of right now, it just means 2 shots. In the future, 3, 4, 5, who fucking knows? Because they don't. Actually, they do. They just don't want to tell you what it means, and they'll just feign ignorance in the meantime. The rule was handed down for all staff who are employed at Medicaid or Medicare-funded hospitals or facilities. Oh, but don't worry, my Vidacap Care plan is just going to have a public option for everyone. Ergo, every facility is going to eventually be a Medicaid or Medicare-funded hospital. See what they're doing? One fucking step at a time, hoping that you don't notice. Unlike the Biden administration's rule that mandates vaccinations or testing for employers with 100 or more workers, the CMS Rule does not allow healthcare staff to opt out of the rule by submitting to weekly testing, although religious and medical exemptions can be accommodated. That's sweet. What about natural immunity? Nobody's bringing that up now, are they? I'm sure it'll probably come up in some of those lawsuits, which we mentioned in the previous video. Ensuring patient safety and protection from COVID-19 has been the focus of our efforts in combating the pandemic and the constantly evolving challenges we're seeing. Yeah, you only focus on the challenges, the ones that you wish to acknowledge, okay? Said CMS Administrator Chiquita Brooks LaSure, in a statement. Wonder if she worked at a banana factory. Today's actions address the risk of unvaccinated healthcare staff to patients' safety and provide stability and uniformity across the nation's healthcare system to strengthen the health of people and the providers who care for them. Just the unvaccinated ones, because there's no such thing as a breakthrough case, right, Jen Psaki? A senior Biden administration official told reporters on Thursday that there is no testing or not a testing option available for healthcare workers. We have a higher bar for healthcare workers. Why? They're heroes, right? Oh, so you need higher standards for them. Creeps. Given their critical role in ensuring the health and safety of their patients, and so it's either vaccination or an exemption under the rules outlined. So if they get an exemption, are they going to have to wear the hazmat suit in order to stop transmission? Or magically, if you get the exemption, you're somehow just as good as being vaccinated, even though you might have a natural immunity and you have the natural antibodies in your system? All of this stuff gets confusing. It's almost like these people haven't really thought out the consequences of their actions. Citing the spread of the Delta variant. Cool. Is that still going on, or is that pretty much just like starting to phase out? Oh, okay, cool. The agency said the move is designed to prevent COVID-19 illnesses among healthcare staff. No, it's not. It's all about compliance. Let's be fucking honest. Somebody's got to be in this fucking tumultuous time. The new requirements will apply to some 76,000 healthcare providers and would cover about 17 million workers across the United States. And it just fucking starts there now, doesn't it? So right, you got to be fully vaccinated, right? You got to just roll up that arm, you just got to bend the knee, and you got to submit to the vaccine. But what does vaccine mean? I can't believe we're at this point in time, but this is peak 2021. I'm just going to go ahead and say this. 2020 was a cakewalk in comparison to 2021. Personally, it's been the worst year ever. I think a lot of people have seen the insanity that's gone around right now and might be able to draw the same conclusion, because now we're dealing with the CDC, full of unelected bureaucrats who make large decisions for your life and you have no say in the matter. They're changing the definition of vaccine because of COVID-19 vaccines. Okay, that once again just instills a whole bunch of faith in the process when you have to start changing the meaning of rules. Center for Disease Control and Prevention altered the definition of vaccine because of a concern that the definition didn't apply to COVID-19 vaccines. Okay, cool. According to a newly released internal email, the agency updated its definition on September 1st. The definition was formerly a product that simulates a person's immune system to produce immunity to a specific specific disease, protecting the person from that disease. The definition now reads, is it going to be something about a symptom suppressor? I haven't read forward just a little bit, but we will now. A preparation that is used to simulate the body's immune response against diseases. A preparation for a definition for vaccine. One CDC employee in August, shortly before the definition was changed, said the definition was being used by right-wing COVID-19 pandemic deniers. I don't think anybody's denying the existence of the virus. They aren't denying the existence of the pandemic because you keep lording it over everybody and restricting any remaining freedoms that they have. So yeah, no, there's nothing about that. There's plenty of people on both sides of the aisle. But once again, yeah, just put that right-wing disclaimer on there. Just add alt or just add far, whatever else you need to do to just stoke fear and then just create the divisive us versus them mentality that's out there. To argue that mRNA vaccines are not vaccines. Well, normally vaccines stop a virus, and that was good enough to meet the definition prior to all of this stuff, but you had to go out there and change it now, didn't you? That's according to newly published emails. Again, published emails, CDC, okay, health organizations. Let's see how far this actually gets. Not very, I bet. The Pfizer and Moderna vaccines utilize messenger mRNA. Oh, I'm sorry, that's what the M stands for. So RNA technology. All three COVID-19 vaccines authorized for use in the United States plummeted in effectiveness against infection several months after receiving them, after initially being promoted as protecting against infection and severe disease. Yeah, now we're looking at efficacy rates in the low 70s when they were touted to begin with. 99% effective. Don't worry about it. They're just going to do everything and include, I don't know, put more hair on your head, grow your dick, put more money in your bank account, all of those wonderful things. This is just the super thing. It'll make you a fucking superhero. But I get ahead of myself before we talk about New York City and fucking Bill de Blasio. The definition was twisted to claim that the existed COVID-19 vaccines were not vaccines because they only prevented severe illness, the CDC employees said about the leaked and published emails. Alicia Downs, how appropriate, lead health communication specialist for the agency, messaged a colleague on August 19th saying that she needed to update the definition and others like it since these definitions are outdated. Cool. What are they, racist? Are they being canceled? Are we canceling definitions? That makes sense. And being used by some to say the COVID-19 vaccines are not vaccines per CDC's own definitions. So it doesn't match up to your own scrutiny. So what do? Instead of just trying to improve your own product, you just change the qualifying metrics. Peak 2021. Valerie Morelli, another CDC official, approved the change on September 1st, even though it seems to differ greatly with the definition that she had laid out in an earlier document. If this is for the general public, I'm good with the change because it's for the greater good. These fucking evil broads, man, they always try to appeal to their altruistic intentions, right? Because this is what this is all about, of course. The emails were obtained by attorney Travis Miller through a FOIA request. The CDC didn't dispute their authenticity. Yeah, because they don't care at this point, because they could get away with literally, okay, if I'm to pull out an old Trumpism, I could go out in the middle of the street on Fifth Avenue, pull out a gun and shoot somebody just like Alec Baldwin. Anyways, so what's going on with the vaccines? And now that we know that vaccine doesn't mean what you thought it did, and like, oh, I don't know, the circa July, how are they affecting regular people? Well. Okay, researchers call for halt on COVID-19 vaccines for pregnant women. No, they're safe and effective. The CDC told us so, right? Oh, okay, cool. So just take at face value some aspects of the CDC's website, and then the others, they're more like guidelines as opposed to really just, hard and fast rules. After reanalysis of CDC Study, so you think that they probably should have, combed this over better, but they're the science after all. They've done all the studies. Apparently they did them, but they didn't review them when they were all completed. Two researchers say countries should halt the administration of COVID-19 vaccines to pregnant and breastfeeding women after reanalyzing a study performed by the CDC researchers. All right, so this is a direct CDC paper So this is very interesting. The study in question, published in the New England Journal of Medicine in April, has been used by the CDC and health agencies in other countries to justify vaccination recommendations to pregnant women and new mothers. A U.S. study of over 35,000 women who were pregnant and had an mRNA COVID-19 vaccine showed that side effects following vaccinations were very similar to those who were pregnant when compared to those who were not. The Australian government, oh my god, you're telling me that the Australian government got something wrong about vaccines? I'm shocked. The study, though, was corrected last month when concerns were raised by researchers in Belgium. Oh, what do they know? They're over on the other side of the world. CDC scientists acknowledged that they should have made clear that they were not accurately calculate a risk estimate for miscarriage. Whoa. Because follow-up data was not yet available for most of the women. Cool, so just go ahead and make these recommendations without actually completing your study. Okay, cool, because you got the information that you wanted before, you know what, the pesky follow-up started to happen. Fucking evil motherfuckers, man. I can't... I know I'm kind of keeping like a pretty level demeanor on this one, but this is so fucking evil. This is really just... I don't know. I'm at my wit's end on this stuff. The correction resolved some of the issues, but there are still some, according to Dr. Simon Thornley, a senior lecturer at the University of Auckland's section of epidemiology and biostatistics. What a quack, right? And Dr. Alicia Brock, another researcher in New Zealand. Oh, okay, cool. So she's probably off on a fucking island of simply sheep, and that's about it, because Jacinda Ardern heard that somebody was speaking badly about anything that she was trying to do. What a fucking tyrant that cunt is. The article's conclusions haven't changed substantially, but we believe warrant a reanalysis of the association related to early exposure to the vaccine in pregnancy, which indicates a substantially increased risk from background. Thornley and Brock reanalyzed the data and calculated the incidence of miscarriages in the first trimester was actually 82% to 91% in the paper. Holy fuck. Of the 827 pregnancies reported through the vSafe registry operated by the CDC, 712 resulted in a live birth. Holy fuck. Nearly all of them were among women who were vaccinated in their third trimester. Of other pregnancies, 104 resulted in miscarriages. Most of those occurred before 13 weeks of gestation. Okay. That somehow makes it better. Using data from the study and several estimates, the New Zealand researchers calculated that spontaneous abortions, it sounds so fun and light, occurred in 81.9% to 91.2% of women who were vaccinated before 20 weeks of gestation. Now, it's totally safe and effective to get a vaccine if you're pregnant. Okay. We question the conclusions of the Shimaburko et al. Study to support the use of mRNA vaccines in early pregnancy, which has now been hastily incorporated into many international guidelines for vaccine use, including in New Zealand, the researcher said. The assumption that exposure in the third trimester cohort is representative of the effect of exposure throughout pregnancy is questionable. It ignores past experiences with drugs such as thalidomide, something I've referenced quite a bit, and looks like it was an apt comparison. Evidence of the safety of the product when used in the first and second trimester cannot be established until these cohorts have been followed to at least a prenatal period and long-term safety determined for any of the babies born to mothers inoculated during pregnancy. They added, Pfizer, who is noted, says the vaccine labels that available data on the vaccine administered to pregnant women are insufficient to inform vaccine-associated risk in pregnancy. Yeah, but just shut up and get it. CDC researchers concluded their findings didn't show any obvious safety signals among pregnant women who received the Pfizer or Moderna vaccines. They said their findings did not necessarily present the position of the CDC, but the agency linked to the study and the website it used to promote vaccination in pregnant women, and the query sent to the study's main author was forwarded to the CDC spokeswoman, who pointed to an August statement regarding the study. Holy fuck. We are aware that some of the data has been used to calculate a higher rate of miscarriage. So they were aware of this and they did nothing. All right. This is not appropriate calculation because the data available is more than 1,000 pregnancies were ongoing, and the outcome data was not available at the time of the report. We didn't finish the study, therefore it's inappropriate to use any of the data that you found out about the study when it was concluded. All right, because we've already just justified telling, sorry, I'm so flustered, telling all pregnant women to just shut up and get the jab. All right, about 10 to 25% of known pregnancies end in miscarriage. CDC experts will continue to study the effect of COVID-19 vaccinations on pregnancies and closely monitor any safety concerns. Sure you will. It took 2 researchers from Australia and New Zealand in order to come to this conclusion. So once again, do your own research. Okay, but what about these kids fresh out of the womb who are now going to have to get vaccinated? Oh, okay, not that fresh out of the womb. 5 to 11 years old. Yeah, the CDC just said, yeah, everything's good. We've done a study. Seen how efficacious those studies have been. I'm pretty sure that's the word. Hence why we journeyed down that path. But now we have New York and what they're doing. That's definitely not going to get weaponized by greedy parents. Blasio's bribing kids, literally, New York City to pay children between the ages of 11 and 5 $100 each to get the vaccine in city-run sites start giving this shot today, Thursday. Okay, that's a lot of candy. What a fucking creep. What's been the most effective way of combating the virus since the beginning of this, and really just good health advice in general? Eating a balanced diet, getting plenty of exercise, getting plenty of sleep, and just taking care of yourself responsibly. No, just take your $100 that you're gonna get and then just buy candy, you fucking communist. I hate this dude so much. Thank God he's almost gone. Oh, and he also, we might get to this sometime in the future, but this made me laugh hysterically. It just didn't really find its way into any sort of story. But de Blasio filed paperwork to run for governor of New York, if you can fucking believe it. This dude has zero self-awareness. But like I said, I just wanted to drop that in there, and maybe we'll get to it in the future if somebody high profile decides that they're going to try to fix that state that just seems to be completely out of control. Mayor Bill de Blasio announced New York City will begin paying children ages 5 to 11 $100 each to get their COVID-19 vaccine as parents lined up to get their kids their first shot. It's going to be payable to the parents, and you know what? Hey, if somebody needs a carton of smokes to go over the weekend, they're just going to go ahead and they're going to take their kid and they're going to get that $100. You know it as well as I do. That's exactly what the fuck is going to happen. It might not be cigarettes. It'll just be, hey, you know what? Mama needs an extra $100. You're already being used to be fucking fleece the government anyway, so why not? Earlier in the week, de Blasio announced that the city would begin vaccination of children ages 5 to 11 at city-run sites starting Thursday and in schools on Monday after the FDA approved Pfizer's 2-dose shots. So are they also going to be putting in vaccine passports in order to get back into public schools? You have to get the jab in order to go to school, and then you're going to get a crispy $100. Cool, just so you can, I don't know, associate handing over personal dignity and authority so you can just, make a quick buck. Cool. Total of 300,000 vaccine doses have been ordered in a mad dash to vaccinate kids. No, they already bought them, and now they're just starting to arrive. It's no wonder why they've already been setting up the state-run sites in order to vaccinate people ever so quickly. Blasio announced following Wednesday's final authorization from the CDC, city-run COVID vaccination sites will offer children 5 to 11 Pfizer, the Pfizer vaccine, FDA approved for emergency authorization. Cool. There have been 680 pediatric under 18 COVID-related deaths in the world. Cool. Since the start of the pandemic, hence why you have to start vaccinating all the kids. That makes sense. According to the CDC, representing less than 0.1% of the deaths in the country. Oh, sorry, my mistake. That's just in the United States. Of 330 million people, 680 kids under the age of 18, not even in the 5 to 11 risk group or the 5 to 11 characterization. that's just under the age of 18. Most of them, well, more than likely, it's been cited several times, have severe underlying health conditions, but this is all for your health and safety, obviously, because the vaccines have been promised are safe and effective. In a press conference on Thursday, de Blasio confirmed that children will be eligible for a $100 vaccine bonus, first announced for adults who received the vaccine on June 30th. Everyone could use a little more money around the holidays, like you care about what other people actually need, you fucking commie. And that it buys a whole lot of candy that they can buy from you in your panel van. Children were already lined up to get vaccinated on Thursday. Yes, I'm sure 100% by their own volition. On Thursday afternoon, in city-run vaccination site in Essex Crossing, 244 Brom Street. I'm going to take a wild guess that that's probably a fairly affluent neighborhood that's probably populated by a lot of, well-to-do families that look exactly like that. I'm just going to go ahead and throw that out there. Jenkins was planning on getting her daughter vaccinated before hearing about the $100 incentive. No shit. We didn't know about the incentive until my husband texted, "We're going to get $100. See, exactly. These people are using their kids as little ATMs. It's fucking sick and disgusting. That's going to be her candy money. What a fucking creep. We're getting $100. That's going to be her candy money. Yeah, I don't know. This is the same picture from the same place, but I don't really see a lot of people lined up to get the vaccine. And the fact that you're already politicizing your kid wearing a stupid mask and having multiple I'm a future voter stickers on your helmet that you probably have to wear around the house at all times, or at least your father probably does, but all this shit just makes me sick. Yeah, a bunch of unfuckable people and single moms just ruining their kids' lives further. I hate them all. I hate them all so very, very much. Oh, that's what constitutes a lineup around the block? What, a large ethnic family? That's sweet. Man, fuck all these people. Not the kids. I'm not a Democrat. But again, we've run the numbers on kids a lot lately, and it just doesn't fucking bear out. But it's not about the science. It's about compliance. You already know that. But now we're going to take a detour and come back up to this wonderful shithole right to the north of everybody watching this. Most of the people watching this. Yeah, we got to talk about Canada because we got some good, we got some bad, we got some crazy, and we got some more blackface because of course we do. I thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.